How is epilepsy treated?
Regarding the treatment for epilepsy, the horizon of treatment for epilepsy has really expanded in the last few years. We initially had only a few drugs, but currently we have a lot of drugs which are available, acting via a lot of different mechanisms, and there may be around nearly 8 to 10 drugs which are available to us oral, and about 4 to 5 IV drugs which are available. So these drugs, depending on the kind of seizures, the patient, you can make a choice. Depending on the side effect profile, the gender of the patient, you can choose the drug which may be most suitable with least side effects and may help the patient, as most of the treatment is generally a long-term therapy wherein the treatment may run for a few years at least. Beyond medicines, there is also something called as epilepsy surgery, which is limited to a very few set of number of patients, which can be for mesial temporal sclerosis patients where you can do bilateral or unilateral temporal lobectomy. You can have something called as a vagal nerve stimulation if a patient is having a epilepsy which cannot be localized. However, the seizure frequency, despite a lot of medicines, remains very high. You can even go for corpus callosectomy or hemispherical division if the seizures are very high in frequency and the patient is repeatedly falling and getting injured because of the tonic-clonic seizures, and they are of a focal onset. That is, they are starting on one part of the brain and then spreading to the other part. So these surgeries also can be used for certain sort of patients. The most commonly done surgeries are the temporal lobectomies, which are generally done even for adult and young children if the seizures are intractable, or by that I mean that not getting well controlled despite 2 to 3 medicines in optimum doses. So this also is a very, very effective treatment in patients of epilepsy, although of a smaller